Good afternoon, everybody. I'd like to give you an update on where we are on COVID and then tell you what we're going to do as we thoughtfully think about the future here in the state of Connecticut. And it's time to think about it. If you look at these numbers, I think obviously the death rate is continuing and it's so disheartening, but it's a lagging indicator. And the hospitalization, you see the plus 18 is the lowest number we've had in weeks now. Yesterday it was up, though, a little bit, but it does give you an idea that there's a trend that's positive for us. The next slide, I think, is indicative. If you could do the next slide, thank you. You'll see that Fairfield County is flattening out a little bit. In fact, their new admissions are down 10%, and that's despite a bit of a spike in Bridgeport. Gives you an idea of the trends there. New Haven is the next line. That as well is flattening out, and their new admissions are down about 35%. Again, a positive trend that we have capacity in our hospitals, and the new admissions, which is an indicator of growth, is slowing. Unfortunately, Hartford, the rate of their hospitalizations were up 30%. And that just reminds you that this is a pandemic that's going to be with us for a while, even though we got to think about what happens next. The last month or two, we've been in the airplane and building it at the same time. And as we've been learning as we go with this fast-changing pandemic, today, as things begin to change, we got to figure out what is a soft landing for that airplane and make sure we do it in a way that we don't bounce back up again, that we get everybody home safely. I just came from a teleconference with the president and vice president, and they'll be announcing very soon their plan. They call it Opening Up America. And it's interesting, there they give guidance. They leave it up to the local governors. They leave it up to the regions. One thing I thought was interesting in terms of the metrics that determine how fast you can open, they pointed out that flu-like symptoms now are probably COVID, because the flu season, the traditional flu season, is behind us. So they look at those symptoms, they look at hospitalization, and they've come up with 3 phases of slowly being able to thoughtfully open up the economy. But all those 3 phases, even in those states that are the least affected, they still are going to maintain temperature checks, still maintain testing, maintain social distancing for the near term anyway, just to make sure that we don't let this pandemic get a second life. We've been working hard here at the state level and working with our fellow governors in the region, thinking about how we get our state going again. And we know that it's a business decision, but more importantly, it's a public health decision. And those two are going to be made together with a focus on the public health, something that Dr. Fauci emphasized as well this afternoon. So in a few minutes, I'm going to be introducing the 2 chairpeople of our Reopen Connecticut Advisory Board. One is on the business side. Her name is Indra Nui. You know that she's a great friend of mine. You remember she was the CEO of Pepsi. You know that she's a chairman of our economic advisory team for the state of Connecticut, along with Jim Smith. And she's leading the business side of this. We have a variety, a number of businesses, large and small, that have signed up and are going to be part of the decision-making process. We're also focusing a lot on those smaller businesses, those service businesses, those that have been most hit by the shutdowns related to the COVID pandemic. Those are restaurants, those are hospitality. We have labor represented on the committee as well to make sure that each and every one of our workers knows that their safety is a paramount concern to our committee and our opening strategy. On the scientific side of our team is Dr. Albert Coe. He is one of Yale's leading epidemiologists, specializing in infectious diseases. We've had a chance to work with him a little bit when we opened up the field hospital down at Southern. And this is in the course of 5 days. He and Indra have put together an amazing team. Dr. Coe will be able to introduce the folks who specialize in the academics who focus on infectious diseases, the entrepreneurs and others who have come up with a lead in terms of other testing strategies, work on therapies. So we're able to bring the best and the brightest together to advise Connecticut, and Connecticut will be there to advise our fellow governors as Indra and Albert represent us with the other states going forward. They recently did a briefing, like 2 hours ago, with the legislative leadership and maintained that collaboration there. And a special shout out to Senator Len Fasano, who did a lot of work on this and shared his analysis, which is going to be a good part of our thinking. We got to hear from small business people, and obviously the legislative leadership has their ear to the ground when it comes to what they hear from the folks that they're representing. We'll be talking about a couple of things. A, what are those metrics that help determine when the state can begin opening up? And hospitalization is something that both Len and I see as a key criterion, because that tells a lot about capacity in our hospitals and how we can maybe take a few more people out, and in case there's a resurge of some sort, we'll have the hospital capacity to do that. That was also mentioned by Dr. Blix. Secondly, just the testing on infections, testing on immunity. These are going to be the different metrics we use as we figure out how and fast and when we can start opening up the state of Connecticut and our regions. A second criterion will be looking at the different regions, as we've talked about before. And again, in the presidents, they're looking at states as different regions and counties within the very big states. You know, we're a small state, so if you open up something in Pomfret and you close it in Hartford, there's a lot of back and forth. So you got to be careful about thinking too closely in terms of regions. People tend to think in terms of a state, but every region and every state is different. California is a state that's thinking loudly in terms of regions as well, red, yellow, and green. Just because it's a big state, they have that space there. We're all thinking about demographics, and if you think about opening, what are your priorities? Probably the folks that are least likely to suffer complications from COVID are younger people. I didn't like the piece in the newspaper the other day that said younger people don't get infected. That's not true. But they're least likely to have complications. They're just as likely to infect others. So we're thinking in terms of the demographics as we open as well, both in terms of young people, but also in terms of seniors and older folks who are the most vulnerable. And in all of our metrics, they're going to have to stay self-quarantining longer, both in, I think, the way we're thinking about it, certainly the way the White House Task Force is thinking about it as well. Another metric we're thinking about is just the protective gear. And that's one of the reasons we have May 20th as a decision node, because by May 20th, we'll have a lot of testing done, which gives us some insights into how fast we can go. And we'll also have, I believe, a lot more of the gear, and especially the masks. And the masks are going to be a lead indicator in terms of who next can get back to work, be it in the manufacturing, be it in the grocery, where there'll be requirements for people for the near term. But maybe you're in a nail salon, maybe you're a barber shop, unsafe perhaps right now for those people to go back, especially given the close contact they have with their clients. But with appropriate testing and then with a mask, by appointment, those are ways that we can bring those Main Street businesses back as well. And finally, I'm thinking about the opening strategy in terms of industry groups. We have essential industries and less essential industries, and those that are more high risk and those that are, less risk. And obviously, you think of big outdoor construction projects, that's an essential industry that we've kept going because it's essential and it's also relatively lower risk, especially with the social distancing and the masks. Manufacturing, another essential industry, but higher risk. And very important that we get the protective gear for them and the thermometers so we can test them in terms of fevers. On the other side of the equation is, and this is in the President's report as well, in terms of less essential and high risk would be probably bars, That would be big sports events where there's an opportunity for contagion. So we're going to think in terms of industry groups as other ways that we can focus on our opening strategy. And before I introduce Indra Nooyi, I just want to say that as the President gave us a brief look at what he's thinking about in terms of his opening strategy, mentioned the importance of sports events, and then he threw the ball right to me, and I had to think fast, and I said, I want you to know that the Travelers Golf Tournament will be played in Connecticut in June with no fans. It'll be a different experience, but we're thinking as well in terms of how we open up our state in a very thoughtful way that puts our folks at the least risk, mitigates the risk of a second surge in this, and make sure our seniors can stay safe. With that, I'd really love to reintroduce Indra Nooyi to you, who's come out of nowhere in the last week to help get this group organized. And tell us what you've learned, Indra.
Thank you, Governor. Thank you for giving me the opportunity to serve you and the citizens of Connecticut as a co-chair of this task force with the incredible Dr. Albert Coe, from whom I'm learning so much every day. And I'll just make one correction. I thought New York Yankees baseball was essential business. I guess not. But our goal on this task force is to, on this advisory group, is to develop a plan to reopen Connecticut as soon and as safely as possible. As soon and as safely as possible. And the way we want to do it is using fact-based analysis, very carefully considering the public health consequences of anything we do. And we want to make sure whatever we come up with is a sustainable approach, because the worst outcome is reopen Connecticut and we have to reverse direction. We don't want that to happen. So we want to have a sustainable approach, carefully considering public health. So Dr. Coe will talk about the public health perspective on when we can reopen. So Dr. Coe.
Thank you, Indra. And I also want to thank the governor for the privilege to serve the state and work with, especially with Indra and the member of the advisory board. So I think when we're thinking about where we need to go, we first have to answer, before we answer the question of how we're going to go to reopen the state, we need to identify where we need to go. And the first criteria is that we have to have a decline in cases and hospitalizations. This is not only important in terms of controlling the outbreak, but we need to make sure that we're out of the surge and that we protect our hospitals. The second criteria is really the fundamentals of public health prevention and control. We need to implement mass testing, contact tracing, and self-isolation. This is testing all individuals who are sick, whether they're in the hospital or at the home, trace their contacts, and then have those contacts that are infected self-isolate so we can prevent transmission.
I think we maybe lost Dr. Coe there for a minute. Well, we get back Dr. Coe and Indra. Let me just say a little bit more about them.
Homes, which are,
oh, here he comes.
I'm sorry. And so the next criteria is to have the adequate supply of PPE. That's not only to protect the people and the healthcare workers in the hospitals, but also to protect the community. The next criteria that we need to fulfill when we're thinking about reopening the state is continued physical distancing and regulations. If we're going to reopen the state, we have to have the best practices for mitigating or suppressing transmission in the workplace, in the general community. And last of all, we have to have adequate healthcare capacity for all. So we need to get our hospitals back in service so they can provide the care that we expect for all patients, not only those who have COVID infections, but also those without COVID infections. We have to do the surgeries that have been delayed. We have to treat patients whether they come in with heart attacks or asthma. We have to do the deliveries for mothers who are expecting, at the level of care we had before the surge. Let me hand this now over back to Indra. go over the strategies.
So while Dr. Ko is working through the public health criteria for when we can reopen, the business team is off working to develop the strategies. How can we reopen the state in a phased way? Can we open it regionally? Can we go by industry segment, certain segments like, beauty salons, nail salons, hairdressers? Should we go by industry segment? Should we do large companies versus small companies? Should we do it by age and risk groups? Should we allow all the young people to go back to work and then wait for the high-risk people, until we are comfortable that they can go back into the workforce? We are looking at every one of these clusters and ways to reopen the economy because we want to do it in a judicious way. And again, we're not looking for a big bang approach. We're also willing to look at incremental approaches to somehow give people hope that the economy is coming back. So we have a business team that's hard at work at this, keeping these criteria in mind. But Albert, you have other considerations that you want us to take into account.
Yes, so thank you, Indra. So when we're thinking about strategies, about not only reopening Connecticut, but keeping our citizens, our friends and colleagues safe, there's several considerations. I think the first and most important one is that there's really no magic bullet at this point. The safe and efficacious vaccines are likely 18 months or a year and a half, if not 2 years away from us. So we have to invest in the hard work now, the hard work in terms of public health and in the hospitals. We do have some evidence, we do have some experiences for best practices that have been done in other states, but many times the countries that have been able to control the epidemic in Asia. And those go back to the ABCs, which is mass testing, offering testing to all members of our communities who are ill from the disease, screening these mass screening, tracing the contacts and isolating them. And that's, I think, one of the things that we've learned throughout the epidemic as it started that last December from China. And we also have to have flexibility in the plan as new evidence will surface. We're constantly learning from this epidemic. We're going to have new diagnostics, new therapeutics, and hopefully new vaccines. And as these come on, we're going to have to be flexible and also learning from our own experience here in Connecticut as we roll out these interventions and these prevention campaigns. And I think finally, we have to understand that reopening will require social distancing. We're going to be able to toggle up and toggle down, based on, and I think the real threat that we're worried about is what the governor had referred as rebound outbreaks that may occur. And so this disease is highly transmissible. We've seen these rebound outbreaks occur in other countries. And even if we reach the benchmarks to reopen, this disease is not going to go away. So we're going to have to put in place social distancing, continuous social distancing, not only in the hospitals, but also in the workplace. So with that, let me hand it back to Indra.
And all of you should feel comfortable knowing that we have an excellent team that's leading this effort. Besides Albert and myself, who are the co-chairs of the effort, we have a great team of experts supporting our initiative. Oni Chakwu is leading the business side of this whole team, along with me. And on the scientific side, we have outstanding people like David Scheer, Harlan Krumholz, Alex Karnala from Deerfield, Mahmood Khan, and Charles Lee from Jackson Institute. And all of them have basically given up their regular jobs to spend most of their time working to help reopen Connecticut. So the contribution that people want to make to reopening the state is just unbelievable. Now, this advisory group is ably supported by the executive branch, besides the governor, Paul Mounds as chief of staff, the incredible Josh Gabal, Renee Coleman Mitchell, David Lehman, Amy Porter, Matt Carter. Everybody's working hand in glove with the advisory group because we all want to get to the right answers soon. And it's not just the advisory group. Each of us is supported by a much larger group of experts from the state of Connecticut and otherwise who all want to contribute their time, their knowledge, and their capabilities to this initiative. There are large teams supporting each person, and it doesn't matter at what time of the day or night we call for a meeting, everybody's on the Zoom call trying to discuss the issue and get to the right answer. And finally, I'd be remiss if I didn't mention our legislative leadership. Albert and I had a meeting with them a couple of hours ago. It was a very constructive meeting, great questions, and we look forward to an ongoing partnership with them as together we develop the right plan for Connecticut. So the next steps then is to establish the timelines. As the governor mentioned, this is day 5, and the teams have just come together in the last 2 days. But over the next week or so, we start establishing the timelines, and we will update everybody continually. And this is going to be an iterative process. But I feel confident that this team that has been chartered by the governor will get to the right answer, an answer that's right for Connecticut, right for the people of Connecticut. Thank you.
Thank you, Indra and Dr. Ko. If I could take the liberty of asking the first question. Dr. Ko, you've been studying infectious diseases for most of your life and one of the world's leading experts. What surprises you and what worries you about COVID?
Right. So I think what surprises us is actually how transmissible or how easily spread this disease is spreading and not respecting borders, not respecting populations in different groups. And we saw this, this impressive, pandemic start in China just 3 or 4 months ago, and now coming, affecting our own citizens here in the state. I think what worries us is one, and this, as a physician working at Yale New Haven Hospital, seeing the patients come in those vulnerable groups that you had talked about before, the ones who are, the elderly having to go onto mechanical ventilation, the high mortality rates or death rates that are occurring in those populations. We're also seeing, unusual complications, COVID presenting as heart attacks, specifically that concern us. I think the other thing that worried about is that, or concerned about, but I think that's something that we're going to be able to mount, harnessing all the resources here in the state of Connecticut, is really the challenge. I worked in Brazil where we've had outbreaks, and we have systems. We have teams to do mass screening, to do mass vaccination, to do things on the large scale. Here in this, in the United States, we haven't had that experience, and we need to build that infrastructure quickly. But I'm sure that, I have complete confidence that, harnessing all the expertise and the institutions here, both private and public here in Connecticut, will be able to address that challenge.
Thank you, Doctor. Any questions, Max?
We'll start with the Associated Press.
Good afternoon, Governor. I had asked you yesterday about the regional effort regarding the starting back up. I was wondering, would this international alliance still be needed if the governors in the region believe that the federal administration had planning for the reopening under control? And if so, what would be different about it?
Look, I think it makes sense for us to work regionally regardless of what the federal government does. And it'll be Dr. Ko and Indra who will represent Connecticut on that regional alliance, and I think Connecticut's going to be a leader given the firepower that we're bringing there. I've got to work, as you know, with Gina Raimondo and Charlie Baker and Andrew Cuomo when it comes to opening up bars and restaurants. Doesn't make sense to close them in one place and open them in another. All that means is a lot of transportation and travel back and forth. I want to be able to share the best ideas from New York and the other states in terms of testing protocols and what's working and what's not working. End of the day, though, Connecticut makes up its own mind.
What was your reaction today to the plan that the White House put out? And I have one more after this for Paul Hughes. I just had to throw that in there.
Yeah. Look, I thought the White House plan was responsible. There's always a lot of theatrics coming out of Washington, D.C., and we get nervous, and who's going to be the mutineer? But At the end of the day, we settle down. We've got a good plan, I think, in place that gives a lot of discretion to the governors, all the discretion to the governors, really, and guidance from the federal government, and I welcome that guidance. So I think we're on the right track.
And just to throw in for the Waterbury Republican American, public health officials have said an average of 500 to 600 people die of the flu every year in Connecticut. Now the deaths from COVID are approaching 1,000 in a little more than a month. How many COVID-associated deaths have you been advised to expect? Thank you.
Dr. Koh, how many COVID-related deaths should we expect?
Yeah, so I think, those, when we're in the middle of an epidemic, those are hard statistics to get. And one of the reasons is because, what we're finding out in COVID is that when people come in sick into the hospitals, many times the deaths are happening 4, 5, 6 weeks afterwards. So that makes it not only difficult to know what is the death rate that occurs, or what we call the case fatality rate, but it also makes it difficult to understand, project how many are going to be happening. I think the most important issue is that what's the bottom of that pyramid? What are all the infections that are fueling those the cases that are going to the hospitals and becoming sick? What are those the people coming to the hospitals that need intubation? They need to be on mechanical ventilators that are actually having severe complications of disease, and one that finally those deaths. So I think the basic public health principle is start at the bottom of the pyramid. And from that, working up, you'll prevent the deaths.
Thank you.
Move on to the Connecticut Mirror.
Some of the metrics you outlined earlier are hard they're hard numbers. They're easy to follow. For example, the 14-day decline in cases and hospitalizations. But then there are other things that seem to still have an element of the unknown. I'm talking about the availability of testing. Can you give us a sense of how these things mesh together? For example, if we have 14 straight days of decline in hospitalizations and deaths or cases, but yet the testing perhaps is still ramping up, what does that mean to your recommendations for reopening?
I think I'm going to hand that over to the experts, but I was interested, Paz, that the federal government had the same 14-day metric, given that's the incubation period. And they talked about cases and they talked about hospitalization in the same way that we are.
So, okay, so that's an important question, and that's how the different criteria relate to each other. In the best case scenario, and in the scenario that I think we have to, that we need to aim for, all those criteria are important. And I think one of the work, the work of the committee we've started 2 or 3 days ago is to really get granular and to really drill down on what are those exact criteria. In terms of, the decline in cases and hospitalizations, we have to understand, and the governor brought up a really important point, that when we see hospitalizations, we're looking back at what happened 14 days ago when people actually got infected. When we look at deaths, we're looking at 3 or 4 weeks backwards. So we have to be, and that's why we brought in actually the leading experts, not only here in Connecticut and nationally, but internationally, to really drill down on what are those metrics that we're going to be doing, and doing it not only, at the level of what's used across the country, but actually at a higher level, so we can have more precise measurements. You can imagine that Greenwich or in Fairfield counties, those metrics are going to be different because they got hit first in the epidemic than when we're thinking about Hartford. So we can't think of the state with aggregated information. We're going to have to think about that at the county level and the hospital level, and that's why we're bringing together the experts to really drill down on what those are.
Well, this is a small state, and already we're hearing people suggest that in Eastern Connecticut, where the hospitalizations have never been very high, that it should be treated differently. So as an epidemiologist, What are you going to say to people who are going to be pressing you if they're in a part of the state where they have 14 good days of results and caseloads and whatnot?
Yeah, so that brings up to, I used to live in Boston, and there's a famous politician, Tip O'Neill. And Tip O'Neill's phrase was, all politics is local. So public health is the same. You can't have a one-size-fits-all type of solution. And that's something that we're going to have to, take into account. And I think Indra said this very eloquently, that when we're thinking about not only the public health, but the businesses and when they're what's opening, we're going to have to think about that in terms of how old they are, what size, whether it's large businesses, small businesses. Those are the kind of questions. Those are the kind of challenges. But not only challenges, but those are the opportunities that we have to actually, come up with a plan that's robust enough for the case of Connecticut. I just say Connecticut's a small state, but we actually have large differences. If you look at, I live in the city of New Haven. Just from where I live, and I go 5 blocks over, it's a completely different neighborhood with different conditions. And that's the type of public health programs that we're going to have to think about, not only for the state, but actually in the local and in the communities and in our cities.
Thank you.
Move on next to Boceto Media.
Good afternoon, Governor. Governor Lamont, as you are planning to reopen the economy, parents are thinking that schools will reopen after May 20th, but they are afraid to start especially when there's no treatment or vaccination to the COVID-19, and maybe have addressed.
Mary Carmen, there's an issue with your audio. We're hearing an echo.
There was an agreement for COVID-19. State started partnering with businesses to start hiring Connecticut residents as soon as we start going back to normal. Thanks.
Mary Carmen, can you repeat your question, please?
Sure. Can you hear me?
Yes, now we can.
Okay. Thank you. Governor Lamont, as you are planning to reopen the economy, parents are thinking that schools will reopen after May 20th, but they are afraid to send back their children, especially when there is no treatment or vaccination to the COVID-19. Many have addressed they also have a say in this decision. What would you tell these families? And my second question was, considering that there was unemployment before and presently for COVID-19, has the state started partnering with businesses to start hiring Connecticut residents as soon as we start going back to normal? Thank you so much.
Yeah, what we're trying to do, thank you for that question, is a bridge to a therapy, a bridge to immunization, a way to keep people safe. And in the meantime, Indra and Dr. Ko are helping us make judgments along the way. I've asked them, I've said, look, I've got to tell the people of Connecticut in the next 2-3 weeks what to expect after May 20th. Do you think there's a chance that schools are going to open? Or given the fact that we still have a surge of infections in the northern part of the state, that would be not the right thing to do? What should people expect in terms of businesses? So I can give you clear guidelines in terms of what you can think. Because I do believe that the people of Connecticut need a sense of direction. That it's not going to be easy, and it was just the beginning of the beginning now, and we're going to do it in a cautious way, but a real sense of direction about where we're going. And schools is obviously a key part of that decision.
We'll move on next to Channel 3 Eyewitness News.
Yes, this question is for Dr. Cole, talking about antibody testing. If this is going to be a key metric for reopening the state, do we have enough tests, or are we going to be in the same spot like we were at the beginning of the pandemic where there were not enough tests?
Oh, thank you for that question. And that is an important question in terms of, when we're thinking about what can we do as a public health intervention. Let me just emphasize that at this point, the most important test is what we call the PCR test or molecular detection test. That detects the virus and people are actively infected. And that's the first priority. We need to find out who's infected, isolate, have them undergo self-isolation, and then trace their contacts. So that's the priority test. The antibody test is actually an important tool for public health. It doesn't actually, at the individual level, at the person of somebody who takes that antibody test, it won't provide at this point information that's important for what they should do or what they have. And that's the reason why is because antibodies tell you that you've been infected in the past, okay? At this point, we don't know if somebody who's been infected in the past is actually going to be able to be infected in the future or is immune, from infection. So with the current scientific evidence, we don't know that answer, but at least in terms of its value for public health, it tells us if we do this, with the surveys across the state, it tells us which communities are being hit hardest or which regions are hit hardest and where we can target public health prevention. But again, as an individual level test, its value is uncertain about whether it can actually inform people whether they can go back to work based on current scientific evidence.
What's our status on the PCR tests? I mean, do we have enough right now in the state?
So right now at the state, we are testing everybody who is actually being hospitalized, but we need to ramp that up so we can actually test everybody who not only comes to the hospital, they come into our emergency rooms, our outpatient clinics, and who stay in the community and who are ill in the community. So for that reason, I think one of the key cornerstones of any strategy is ramping up that capacity to test and actually building that capacity here in the state of Connecticut. I may probably hand this over to Indra, who can maybe actually talk a little bit more about the importance of the capacity issues.
That we have to address in this whole reopen strategy is the supply chains that have to be laid down. Getting the testing in, the test kits, making sure we have laboratory capacity to actually conduct the tests, and the whole system to get people tested and then record all their data. That's the big supply chain challenge in front of us. Now on the PCR test that Dr. Ko is talking about, it's not just the fact that the test kits have to come in. We need the swabs. We need all of the supporting material for the test itself, unless we go straight to a saliva test, which makes it much easier. So even the testing protocols and which test we're going to use is something we are working through right now. But once we lock and load on a test, and I hope that's very soon, we will start laying down the supply chain very fast. We have the best people working on it. We will lay down the supply chains. Already we're hearing that the capacity in Jackson Labs, Yale, UConn, and Semaphore, companies like Semaphore, testing capacity is being increased 4-fold and 5-fold just to cater to the needs of Connecticut. So this is how the state is stepping up. So I think getting all of the supporting systems to align with our core plan is critically important. It's a big program management challenge. And we're up to it because we've all done it in business before. So we're working through all these details and, we'll tell you more about it as the weeks pass.
We'll move on next to CT News Junkie.
Great, thank you. Earlier this week, Governor, you changed the state contracting standards. Has that made an impact on the amount of PPE you've received?
Look, it was the Wild West out there, and in many cases, if we wanted to get the masks we needed, we had to be a little more aggressive in terms of providing some of the shipping up front and providing some of the funding up front, only if we could vet that in the most serious way. We found 2 or 3 cases where we could vet it. We had a high degree of confidence, and we're willing to take the financial risk in order to get the protective gear that our people deserve.
And was that possible? Were you able to do that? I mean, have you been able to make some of these payments up front and get materials like masks to the state?
Want to speak to that?
Yeah, we've been very aggressive, Christine, as we've discussed previously. And in particular, the executive order earlier this week helps enable us to contract directly with Chinese manufacturers, which is not something the state has ever done before, as you could probably imagine. And there are certain terms in our standard contract around, U.S.-based laws that just simply aren't applicable. So we needed to be able to move quickly in that regard. And it has been helpful. And we do have a number of large orders that we are getting increasingly confident. As the governor said, we are receiving shipments. We're getting PPE out to the front lines every day, hundreds of thousands of pieces. But we do want to build up that stockpile.
And Governor, can you address the concerns of the ACLU regarding contact tracing using Bluetooth technology?
We haven't made any determination about that. So whatever we do, we're going to have the respect of privacy and work with organizations like the ACLU to make sure we do it appropriately. But let's face it, contact tracing is really key, as Dr. Koh will remind us, if you want to stem this pandemic in a serious way. We're working on programs that'll be voluntary as we start rolling these out, and I'd like to think that people would allow us to do a better job of tracking where they've been in order to keep them safe and everybody they know safe.
And I have a question for Ken Dixon of Hearst. Abbott lab tests seem not to be 100% effective. Are you satisfied with the test? And also, what kind of legal teeth were in the face mask executive order?
Say that one more time. What type of legal?
He says, what type of kind of legal teeth were your face mask executive order would it have?
Oh, I see. Well, I'll start on the face mask, and you take the Abbott lab, if that's okay. Josh, or Dr. Koh, I suppose. Dr. Koh, you've been there doing a lot of this testing, and we're going to have a major center down in New Haven, and first responders are going to be get the first 100 tests every day to make sure that they are frontline protected. That's part of the deal. Look, right now, all the executive orders I've done have been firm orders. This is what we want you to do. And I got to tell you, Christine, in 99% of the cases or 90% of the cases, people are taking care of that. In those cases where they're not, where we have to go up and I have to send somebody from law enforcement, it's generally a friendly reminder. And as I said before, the second time around, it's going to be not such a friendly reminder, a stern reminder that if you want to keep your store open, this is what you're going to have to do. And I think right now that's working. When it comes to the mask, and there's a lot of judgment involved there. If you're in, Bark Hempstead walking around and there's not a big crowd around, but there's obviously no legal obligation to wear a mask in a situation like that. If you go into a store, if you're in a crowded area, yes, you put your mask on at that point. Is that going to be a punishable offense? We're not thinking about it that way. We're saying this is what you got to do, and I hope your neighbors help police you if you don't.
We'll move on.
I guess I can.
Oh, sorry.
I guess I can answer the question about the tests and specifically the question of the Abbott test. So I think it's important for everyone to know that no test is 100% perfect.
Dr. Koh, can you turn your video on?
We live day to day using tests that are not 100% perfect, but yet they yield important information, not only for clinical practice, but also for public health prevention. And with respect to the Abbott test, is a problem which we find in many of the tests, the PCR tests. So as many people know, in order to diagnose or to detect the COVID virus, you have to stick a swab to the back of the nose. And it's actually not the test that's not able to detect the virus. It's actually the differences or the variation in people, different healthcare workers in actually doing the swabbing. What we're trying to do now, not only here, but also the research and development industry here in Connecticut, is come up with better tests. One where you don't have to stick the swab into the back of the nose. Ones where they're going to have less variation. Ones which are going to give us better performance. And there are several companies here in our own state that are working towards that, working on tests that you could actually use saliva or spit in order to diagnose, which will be much easier, make it much better, not only for our hospitals, emergency rooms, but if we have to do mobile testing units, or if we have to do the drive-through emergencies, drive-through diagnostic centers, it's going to make everything much more easier. And one of the challenges that we're going to have to do is to put those online, integrate it into our plan as soon as possible when these tests become approved, by the regulatory authorities. And I think that's really goes back to the key of the team that the governor and Indra have put together, is that we have the best experts. We know how to do that, from R&D, from the pharmaceutical industry, and actually, having these things go through rapidly in the pipeline.
In Albert, we have some of the best companies on the cutting edge developing this, and it's Connecticut companies, one of the leaders in helping to develop that saliva test, which would make mass testing much more available.
Hartford Current. And Dr. Koh, could you please turn on your video? Hartford Current.
Yes, one for Indra and one for Dr. Koh. Indra, if you could take me through it, how staggered of an approach do you believe will be both for the timeline and the industry? By that I mean, you mentioned beauty salons and barbershops could be by appointment. Are you envisioning that they could open, say, 2-3 weeks ahead of restaurants, which are a totally different situation with 25, 50 people sitting there, and that the whole thing would be bifurcated by industry and timeline?
Is that a question or a great idea?
Well, I don't know. I'm paying attention to you.
No, I think you're giving us a great idea. What we're going to be doing in developing the plan is taking everybody's ideas, because this is one thing that we've never done before. So we'd like everybody's ideas on how to creatively approach a staggered or a phased opening. Then we look at all of this and say how best to open industries or geographies or some combination of these. Things are going to be different. There's going to be some form of social distancing. We just need to make sure that whatever we do does not result in any problems from a COVID infection perspective. So we're looking for ideas. Incremental ideas are as good as big bang ideas. So keep them coming. We'll incorporate it in our thinking. And believe me, no idea is too small or too big. So please keep them coming.
And also, Dr. Koh, can you help me understand? I believe they said initially Fairfield County numbers were going down, but there is a spike in Bridgeport Hospital. Can you address that? Do you have particular reasons for a spike at Bridgeport Hospital?
Yeah, so thank you very much for that question. So as many of us know, and that's because, going back to what the governor said, is that we're living in an increasingly interconnected world. And as the epicenter of the epidemic here in the East Coast, and particularly in our region, was the Westchester County, the initial cases of New Rochelle. And because of that interconnectivity with Fairfield County, that was the first of our counties that got hit. And now the question that comes with Bridgeport is a question that we haven't actually have the chance or the opportunity, at least our board, to really understand why that hospital specifically. So Bridgeport Hospital serves a very different community than the rest of Fairfield County. And it's a urban, it's a congested, or it's a more densely populated urban county, much like New Haven, much like Hartford. And we know that proximity or increased contact, people living closer to each other, actually, is one of the drivers or one of the factors that promote transmission. So, these are all things that we're going to have to drill down on. We started 2 or 3 days ago, but that's an important phenomenon. That's something that we have to deal with as we are thinking not only of getting ourselves out of the surge, controlling the epidemic, but actually keeping it under control in the future.
We'll move on next to News 12 Connecticut.
Yes, thank you, Governor and team. My question is for Josh. When will the nursing home numbers be released, and how will they be released to us?
Sure. So they'll be released in our press release this afternoon after this event, which comes out nightly, as you know. As mentioned yesterday, Thursdays will be our day for the more comprehensive package with the updates on not just nursing homes, but age and ethnicity breakdowns of the key data. We can, so in the press release tonight will be the list of every nursing home that has had at least one COVID-19 case diagnosed. It'll show the number of licensed beds in that home, the number of infections in that home, and the number of deaths attributed to residents or former residents of that home that we've been able to reconcile. And just in aggregate, it's about 15,000 licensed beds that are included by the homes that have had at least one outbreak. About 11% of those beds have experienced a COVID infection at this point, and about 2% have passed away at this stage. So I think it's a real testament to our nursing homes, to the nurses, to the staff there, and the work that they've been doing to put in place the right infection control procedures. We know this is a highly at-risk population. We've seen that across the nation, across the world, and the teams are doing great work in our nursing homes to really try to protect those residents.
We'll move on next to Connecticut Public Radio.
Thanks. My question is for Dr. Koh, and it's on the issue of contact tracing. I remember State Epidemiologist Matt Carter saying last month that this was something the state wouldn't be able to really do as the outbreak sort of ramped up to points like where we are now. So my question is widespread contact tracing currently happening in Connecticut? And if not, how do we decide when we have the resources and training to get widespread contact tracing up and running?
Well, thank you for that question. And I think the important issue is to go back to the fundamentals of the ABC. So contact tracing is going to be one of the pillars of how we're going to control this epidemic, but it's also going to be one of the pillars of how we're going to keep us out of rebound, or the threat of rebound outbreaks as we're going to open up this state. So how do we do it? So you're absolutely right. It's not just here in Connecticut, but this is throughout the whole country. The public health system has been was overwhelmed by the COVID epidemic, and we don't have here in the United States the infrastructure, the capacity to have dealt this. We have actually never dealt with this. When we do contact tracing, it's usually on cases of tuberculosis, sometimes sexually transmitted diseases, but we don't have the infrastructure here in the country to adequately roll out mass contact tracing at the levels we need to. And that's why one of the important, pillars of our program is actually to ramp that up, quickly, so that we can use not only the current methods, but actually use better methods. The methods that we have in contact tracing actually are the same ones that we used 150 years ago, 200 years ago for investigating diseases like typhoid fever or cholera. We're going to have to put in new technology and think out of the box about how we're going to do this efficiently. Not only efficiently, but doing this ethically, using the same rules that we have applied for contact tracing and tuberculosis. We need to have that same ethical standards as we're rolling this out in mass scale here in the state of Connecticut.
And I had one more question for the governor. Governor, you had talked in the past about setting up recovery centers for COVID-19 patients discharged from hospitals. Are any of those currently in use and accepting patients, and if so, where?
Are there any right now?
Yes. The first alternate COVID alternate care facility is operational and accepting patients in Sharon, and we have 2 others we expect to come online over the weekend or Monday, and several others that are being negotiated right now to open as well. So we are operational.
We'll move on.
Thank you.
Oh, sorry, Patrick. We'll move on next to NBC Connecticut.
Governor, as you were addressing the public this afternoon, a caravan of nursing home workers were circling the parking lot outside of the Capitol demanding more PPE. Does the state bear any responsibility for not moving quicker to give them the tools to protect their residents and workers?
I think we move faster than any of our neighboring states. We got out there, we placed the order, we knew exactly what we needed to do. We've been working with the Washington, D.C., seeing what we can get out of their strategic stockpile, which is not much, to tell you the truth. As Josh said, every day he's on the phone with all the nursing homes and finding out, at least DPH is, and making sure we can at least get them what they need. Do we have a lot of margin? No, we don't, but at least we're able to get them the basic things they need on a day-to-day basis until we can build up our stockpile. Nobody takes it more to heart than I do that, early on in this pandemic, we didn't have all the PPE we needed and our people deserved. I'm glad that the hospitals took it upon themselves to go out and get a lot of the gear that they needed. The nursing homes rely a little bit more upon us, and we're getting them everything we can.
And Josh, you just answered a question regarding the nursing homes that are accepting COVID patients. The first one just came online. This has been going on for a month now. What's taken so long?
Well, there's a lot of stakeholders involved. It's a very complicated environment, as you're aware, very at-risk patients, and getting all the right frameworks in place, the right financial models in place, and also adjusting to the science. And as Dr. Koh mentioned earlier, we're still learning new things every day, and we had to take a change of direction about a week and a half ago when the CDC updated their guidance to indicate that COVID could be transmitted up to 48 hours before someone starts exhibiting symptoms. That changed the plan significantly in terms of what we can assume and what we should not assume relative to our existing population. So the team's been working extremely hard. There's a lot of stakeholders involved, but we're getting to where we need to get to be able to do everything we can to protect the residents in those homes who we're so concerned about.
And lastly, Dr. Koh, it sounds like this contact tracing is integral to your plan. Can you talk a little bit about how it's going to work as far as making everyone they've had contact with self-isolate? I imagine if you went to a grocery store, for instance, you wouldn't know all the people that you contacted. And I understand from a previous question that Bluetooth will be involved. Kind of dumb it down for us. Explain how the contact tracing really works.
Okay, thank you very much. So I think, there are two important pieces of that intervention that are important. The most important thing is to again go back to the ABCs, is that we test people who have symptoms and who may have COVID. Because if we test them, diagnose them, and have them self-isolate, we've already won half the battle in terms of reducing the transmission. The contact tracing is important because we don't want people who are asymptomatic. That means people who don't have symptoms but are capable of transmitting the disease. And this goes back to what Josh says. Having contacts or spreading the disease in the infection in the community. So what we need to do is we take somebody who is, who has been symptomatic, who has been ill, and who has been diagnosed with COVID infection. We then ask them their contacts, right? And then those contacts, we find out who are those who are ill, and we have them self-isolate. Those other contacts who may be infected but don't show symptoms, they also need to self-isolate. And then we keep on going, working our way so we can work up that pyramid so that we can get as many people actually working down the pyramid so we can get as many people who are infected off of the streets, out of the grocery stores, so that we can actually protect the community and the population in large. Now, the big issue is how to do that, and actually how to do that not using the old methods, but the new methods. And this is a discussion that's going to be done with, throughout, not only here in Connecticut, but in harmony, in harmonizing with New York, New Jersey, and other states, Rhode Island, on that. We're actually, this is one of the key cornerstones of our program. As we know, other states and as well as Connecticut, we're going to have to hire teams of people to do this. So this work is going to require hard work, but it's going to be hard work quickly in order to make all that process of change, the diagnosing patients, tracing their contacts, and then having them self-isolate.
We'll move on next to Fox 61.
Zinnia Maldonado, Fox 61. The state's Recovery Bridge Loan Program is no longer accepting applications and announced today the SBA has run out of funds for the Paycheck Protection Program. What should small business owners that miss these opportunities do now?
I can tell you that the federal government is going to add $250 billion to their bridge loan program. I think you'll be able to see that very soon. Obviously, our bridge loan here in Connecticut, which is $50 million, which is much more than any of our neighboring states, and the federal program were both oversubscribed, which tells you about the depth of the unemployment crisis and what's afflicting small businesses here right now. And that's why what Indra and Dr. Koh are doing is so important. find a way that we can get this state and get this country going again. And I cannot thank these folks enough. We have, dozens of volunteers, the best minds in the state, who are the best minds in the country, looking at an incident that has never been seen before, both in terms of the economic impact and in terms of the disease itself. And that's why we're going to get this thing solved in an honest way that keeps you safe.
Move on next to Dave Major, WTIC, 1080 News.
Dr. Coe, what do you tell the folks here, like the protesters in Michigan yesterday, who, I know that it's tough to wrap your head around the depth of the problem here. What do you tell the sort of science deniers who are out there?
Yeah, I would tell them, I'd bring them into one of the intensive care units that I work in and that many of my team work in. And you can actually just see, this is not this is not like the normal flu. We have cases, in our hospital, we have 70 people on ventilators. And you can see the burden of that. We have, who are in these, units, unfortunately, many of them dying, without their family members coming into the hospital, I think, pictures tell 1,000 words. We can go through all the numbers and why this has impacted our society, not just in terms of the economic, burden, but also the personal burden and the individual burden. And those things are captured, if you just walk into the hospital, you can see what it's done to us. And I think that's probably the easiest and the most, that's probably the most direct answer to that question.
I think that's a real answer. Look, nobody wants to get this state going again and open the doors and get our kids back to school and open up your business and sit outside and be at a cafe on a warm, early summer afternoon, more than Ingenuity and Albert Coe and the people here. And we're going to get that done. We're going to do it in a safe way that keeps your family safe. As Dr. Coe said, the consequences are devastating if we don't get it right. And we're going to get it right, we're going to get it done, and the state's going to come back. Thanks, everybody. Indra.
Thank you, Governor.
Thank you.